So a story broke this week, which was fairly disheartening. Apparently, the governor of Vermont, who's a Democrat, wants to scrap the plan to implement a single-payer healthcare system in the state. And they were supposed to get it done by 2017, but he says that for various tax reasons and reasons involving Obamacare, the numbers just don't work right now, so they're not going to do it. Now, it's strange because he's legally obligated to do it. Like, the legislation already passed. You can't just decide now, like, yeah, no, we decide to not do that. Well, that's too fucking bad. You have to do it. So it's weird that he's saying we're not going to do it when he's obligated to do it, and it seems like he really doesn't want to do it. So the whole situation is just weird. But here's who is pissed. The people of Vermont. They protested in front of the State House. According to reports, it was very angry. And number one, they brought toast. They had a big plate and had a whole bunch of burnt toast on it, and they had a sign with it that basically warned the governor, if you don't follow through with this, your political career is toast. You're done. Okay, I think that's a genius protest move. In fact, I was angry. I never thought of that. I'm like, fuck, every single protest should have toast now. So they're scaring the state government that way, but also, and this I like even more, you know what they decided to do? Burn their medical bills. I could not love the protesters in Vermont on this issue any more than I do. Now, understand something. I don't disbelieve the governor that it's a difficult thing to implement a single-payer healthcare system in a single state when the rest of the country essentially has one version or another of a private healthcare system. I don't think it's an easy thing to do. I believe him when he says that, hey, this is actually going to be more expensive than we thought it would be, and this would require massive changes to the budget, massive amounts of reallocation, and it would require new legislation through the legislature that maybe they wouldn't get on board with, and this might lead to deficit issues, yada, yada, yada. I believe him that it's a hard issue, and I don't think he's necessarily a bad guy because I haven't seen much that indicates before this that he's unreasonable or that he's bad on policy. He seems to be a pretty good Democrat. In fact, he campaigned on the idea of single-payer healthcare. But my response to all of the concerns that he raised would be, do your fucking job. Like, this is why they elected you. They elected you because you made a promise about this. I get it, man. You might have to be up day and night for 4 weeks straight, working hard just to get the ball started rolling in the right direction, right? You're a politician. You don't know dick about implementing a healthcare system. But there are people that do. Call the experts. I mean, there are experts on healthcare in other countries who've set up insanely great systems. Single-payer healthcare systems, all different sorts. In Britain, they have public dollars funding a public system. In France, they have public dollars funding a private system. They have a totally different system in South Korea, for example. It's a different kind of universal healthcare system. So there's so many ways to do it. It just requires you actually buckling down and doing your job. So let's say you have to, hey, sorry, we have to get rid of the startup business tax cuts in Vermont. Or I'm just making up a policy there. Fine, then you have to do it. Hey, we're going to have to raise taxes 2% on the middle class. Well, look, if they're fine with that and it appears like they are, by all means, go right ahead and do it. Hey, we might have to petition the government for some federal help in building this. Hey, that's fine. In fact, there's a provision in Obamacare that allows for that, for states themselves to set up single-payer healthcare systems. Don't tell me there's no way to do it. There is a way to do it. You just don't want to do it as much as everybody thought you did want to do it. So the people that are out there protesting are right. And I have to say, when I read the kind of protest that they're doing, where they're burning their medical bills, I thought, if only we all had the balls to do that at a federal level. Because you cannot be the one douchebag who burns your medical bills. You cannot be, honestly, if you're trying to change the federal system, you cannot be a group of 1,000 people that burn your medical bills. Not going to do it. You can't be the group of 10,000 people that does it. You need to have a march or a protest or a gathering where you have 1 million people or so all burn their medical bills and promise and refuse to pay their medical bills to really get the system scared and to really get them to act and do real systemic change. Obamacare is a step in the right direction, but it's just the beginning. We know a single-payer system is better than that. We know a public option is better than what Obamacare was, which is a free market approach to attempt to fix the system. So we should demand that we at least have a public option, and we should schedule some sort of protest where 1 million of us burn our medical bills, because when we're all united, it's hard to fight back against that. I mean, if the civil rights movement taught us anything, it's that.